I will be talking about renal disease. It will be broken down into 3 sections: renal function, dialysis, and renal transplant. We will begin with renal function. So first, I would like to discuss the A and P of the kidneys briefly as a review. Kidneys are bean-shaped and are highly vascular organs because they are continuously having blood flow through them, because their main job is to filter the blood and either reabsorb or excrete the waste products in fluid. So they are located in the retroperitoneal area on either side of the vertebral column, and they will be located usually between 12th thoracic and 3rd lumbar vertebrae. Structures of the renal system that extend down from the kidneys are going to be your ureters, your urinary bladder, and the urethra. Now the ureters are the cord-like tubes that come down from the kidney and connect to the bladder. The bladder is actually the pouch-like formation organ that sits in the pelvis area and holds the urine, collects the urine before it is expelled from the body, and the urethra is the opening in which the urine is excreted from the body. So the 3 steps that the kidney has that it goes through to collect and eliminate waste from the body are glomerular filtration, tubular reabsorption, and tubular secretion. The glomerular filtration is step 1, and that is when the kidneys, the blood vessels in the kidney, otherwise known as the glomeruli, are going to filter the blood that's flowing through the kidneys. So it goes through the glomeruli, which is a filter, and it filters the blood. So once that occurs, there will be the tubular reabsorption. So there are minute canals known as tubules, and this makes up the kidney. This will be reabsorbed, the filtered fluid or some of the filtered fluid, and then it will go back into the bloodstream, so that when we have the tubular secretion, that will release, as it is reabsorbing the fluid that it needs, is going to release the filtered substance. So the part that is separate from the fluids that the body needs, it's going to also release the substances that it does not, so the waste products. The kidneys have several functions. These include maintaining acid-base balance, filtering and excreting waste products, regulating blood pressure through the secretion of renin, excreting toxin from the blood, secreting erythropoietin, which increases the rate of production of red blood cells in response to low level of oxygen, and the synthesis of vitamin D, which enhances the intestinal absorption of calcium, magnesium, phosphate, and zinc. Infectious and inflammatory disorders of the urinary system. Urinary tract infections, or UTIs, are the most common bacterial disease. They are more common in women and men because of the basic anatomy of the genitalia. There are 2 types of UTIs, upper and lower. Pyelonephritis, also known as kidney infection, is the upper UTI, and cystitis and urethritis is the lower. Pyelonephritis is more dangerous because it may lead to urosepsis. Symptoms of UTIs are basically the same, except with the pyelonephritis or kidney infection. You have the flank pain, dysuria, pain at the costovertebral angle, and a higher fever may be present. Diagnosis is made based on testing the urine for leukocytes, nitrates, and blood. Presence of this in the urine provides a preliminary positive diagnosis. Urine is then sent to a lab for further analysis and a culture and sensitivity. Older adults are at a higher risk for UTIs and often present differently than the younger individuals. The first sign in an older adult may in fact be confusion. Treatment includes antibiotic therapy, increasing fluid intake, and prevention of future infections. Goals of nursing care are symptomatic relief and education regarding methods of prevention. Antibiotics are frequently used in the treatment of UTIs are trimethoprim, sulfamethoxazole, or Bactrim, which is used for uncomplicated or initial infection. A disadvantage of nitrofurantoid or macrodantin is that it needs to be taken 3 to 4 times per day. Fluoroquinolones such as ciprofloxacin, levofloxacin, and moxifloxacin that is used for complicated UTIs. Pyridium is a urinary analgesia which can be used with antibiotics to relieve pain while treatment begins to work. It actually numbs the urinary tract, relieving pain. Problems include staining urine a reddish orange and leading people to think the pain is gone, the infection is gone, is also gone. When this happens, some people stop taking antibiotics because this medication is over the counter. Good teaching is necessary. An acute pyelonephritis usually begins as a lower UTI in either the bladder, ureters, or urethra and ascends to the kidney. With the upper UTI or kidney infection, patients will present with much more significant symptoms and looking much sicker than the lower UTI. A CBC complete blood count is usually added to labs to determine the significance of infection by measuring the WBCs. Chronic pyelonephritis or chronic kidney infection occurs from repeated UTIs and are eventually can cause the kidneys to shrink and atrophy. Function is decreased due to the scarring. It can also be a result of reflux nephropathy where urine fluid flows backwards into the kidneys. This type of chronic pyelonephritis is often associated with hypertension and often progresses to end-stage renal disease. Urethritis and cystitis, which is the inflammation of the urethra and inflammation of the bladder wall, are lower UTIs. Urethritis can be bacterial or viral and is so often caused by STIs. UTIs are also significant and a major source of nosocomial infections. Glomerulonephritis is inflammation of the tiny filters in the kidneys or your glomeruli. Glomeruli remove excess fluid, electrolytes, and waste from the bloodstream and pass them into the urine. Glomerulonephritis can come on suddenly, which is acute, or gradually, which is chronic. Glomerulonephritis occurs on its own or as part of another disease such as lupus or diabetes. Severe or prolonged inflammation associated with glomerulonephritis can damage your kidneys. Treatment depends on the type of glomerulonephritis you have. Glomerular disease involve a wide spectrum of disease processes. They can result from an acute illness, such as an upper respiratory infection that self-resolves, or from chronic disease states such as HIV. In some instances, such illnesses as lupus can cause rapidly progressive renal failure requiring prompt intervention. It is very important to ask questions during the initial patient assessment about recent illnesses or new diagnoses that could be the cause of this illness. This helps ensure the correct diagnosis is made in a timely manner. Signs and symptoms of glomerulonephritis depend on whether it is the acute or chronic form and the cause. The first indication that something is wrong might come from symptoms or from the results of a routine urinalysis. Signs and symptoms include pink or cola-colored urine from red blood cells in the urine or hematuria, a foamy urine due to excess protein or proteinuria, a high blood pressure, which is hypertension, fluid retention or edema with swelling evident in the face, hands, feet, and abdomen. Obstructive uropathies. Different types of obstructive uropathies include kidney stones, strictures, and renal trauma. Urolithiasis, also known as kidney stones, are the result of a buildup of dissolved minerals on the inner lining of the kidneys. They usually consist of calcium oxalate but may be composed of several other compounds. Kidney stones can grow to the size of a golf ball while maintaining a sharp crystalline structure. A kidney stone can stay in the kidney or move into the ureters and then the bladder. A kidney stone can also get stuck in your urinary tract and block urine from getting through. When you pass a kidney stone or a large kidney stone blocks the flow of the urine, it can be very painful. Calcium stones are the most common type of kidney stones. There are other types of kidney stones as you see listed here. A very small kidney stone that moves easily through the urinary tract may not produce any symptoms, and a person may never know that they had a kidney stone. If it is a larger kidney stone, there may be any of the following symptoms: pain while urinating, blood in the urine, sharp pain in the back or lower abdomen, nausea and vomiting. When these symptoms are present, a healthcare provider should be contacted. Usually, the fluid in urine prevents waste products from coming into contact with each other. However, kidney stones can begin to form when there is not enough fluid or too much solid waste content in the urine. Though most kidney stones develop in the kidneys, they can form anywhere in the urinary tract. Although researchers are not exactly sure why or how kidney stones form, there are ways to reduce risk. Those ways include staying hydrated, reducing salt intake, maintaining a healthy body weight, limiting foods with calcium oxalate, and avoiding excessive caffeine consumption. Treatment includes medication. Pain relief may require narcotic medications. The presence of infection requires treatment with antibiotics. Lithotripsy uses sound waves to break up large stones so that they can tunnel surgery, which is percutaneous nephrolithotomy. The stones are removed through a small incision in the back. A person may need this procedure when the stone causes obstruction and infection or is damaging the kidneys. The stone has grown too large to pass, or pain can't be managed. Ureteroscopy is when a stone is stuck in the ureter or bladder. Your doctor may use an instrument called ureteroscope to remove it. Urinary tract surgeries. Surgeries of the urinary tract include nephrectomy, which is the removal of the kidney. Urinary diversion is a surgical procedure to reroute urine flow from its normal pathway. It may be necessary for diseased or defective ureters, bladder, or urethra, either temporarily or permanently. Some diversions result in a stoma. A urinary diversion can be either continent or non-continent. Non-continent urinary diversions often involve linking the ureters to a piece of intestine that is brought out of the abdomen. The urine then drains continuously into an ostomy bag that is worn under clothes. A non-continent diversion is considered less complicated and is associated with the fewer post-operative complications. Therefore, this technique is the standard. With the continent urinary diversion, the surgeon makes a pouch inside the body from part of the intestines to hold urine. There are two basic types: those that have a stoma brought out of the abdomen and those in which a neobladder is made. With a neobladder, the person is able to urinate in a normal way. With a surgical stoma, a catheter will need to be inserted into the stoma to drain the urine 4 to 5 times a day. The advantage of both types of continent urinary diversion is that an ostomy bag is not needed. Diagram of a neobladder. Diagnostic testing utilized in renal issues. Blood tests used for diagnosing renal problems include serum creatinine, which measures the level of creatinine in the blood and provides an estimate of how well kidneys are filtering waste products. This is known as the glomerular filtration rate, or GFR. Creatinine is a chemical waste product produced by muscle metabolism. When the kidneys are functioning normally, they filter creatinine and other waste products out of the blood. These waste products are removed from the body through urination. A normal creatinine level for women is less than 1.2 and less than 1.4 for men. The blood urea nitrogen, or BUN, is normally 7 to 20. As kidney function decreases, the blood urea nitrogen, or BUN, level rises. This test measures the amount of nitrogen in the blood that comes from the waste product urea. Urea is made when protein is broken down into the body. A urinalysis is used to detect and manage a wide range of disorders such as urinary tract infections, kidney disease, and diabetes. A urinalysis involves checking the appearance, concentration, and content of urine. The glomerular filtration rate, GFR, is also used to check how well the kidneys are working. Specifically, it estimates how much blood passes through the glomerular each minute. Glomeruli are the tiny filters in the kidneys that filter waste from the blood. A normal GFR is greater than 90. A GFR that is less than 60 is significant for decreased kidney function, and below 15, there is a high risk for needing treatment for kidney failure like dialysis or a kidney transplant. Also called renal ultrasound, a kidney ultrasound is a non-invasive exam that uses ultrasound waves to produce images of the kidneys. These images can evaluate the location, size, and shape of the kidneys, as well as the blood flow to the kidneys. A kidney ultrasound usually includes the bladder too. CAT scan of the kidneys can give more detailed information about the kidneys than standard X-rays. This can provide more information related to injuries or diseases of the kidneys. A kidney biopsy is a procedure that involves taking a small piece of kidney tissue for examination with a microscope. It can be done either percutaneously or open. Recovery after a needle kidney biopsy, the patient must lie down on their back for several hours. After this, they should avoid strenuous activity for the next 2 to 3 days. It's normal to feel some soreness in the area of the biopsy for 2 to 3 days. Bleeding is the most common complication of renal biopsy. Therefore, it would be contraindicated in anticoagulation therapy without prior reversal. An intravenous pyelogram, or IVP, is an X-ray examination of the kidneys, ureters, and the urinary bladder that uses iodinated contrast material injected into veins. A renal angiogram is an imaging test to look at the blood vessels in the kidneys. It can visualize the ballooning of a blood vessel, like aneurysm, narrowing of a blood vessel, stenosis, or blockages in a blood vessel. Blood flow in the kidneys can also be evaluated. A renal scan involves the use of radioactive material to examine the kidneys and assess their function. It is also known as renal scintigraphy or renal imaging or renogram. During this procedure, a radioactive material called radioisotope is injected into the vein. Cystoscopy or cystourethroskopy is a procedure where the inside of the bladder and urethra are viewed in detail.